My name is Dr. Ashish Tiwari, and I'm a retina specialist at the Michigan Retina Center. We are a practice that's focused on the medical and surgical diseases of retina, and we're based in Ann Arbor and Metro Detroit. Prior to this, I was on faculty at the Kresge Eye Institute at Wayne State University for over a decade and was involved in the training of our retina fellows. We do our surgeries at St. Joseph's Hospital in Ann Arbor and use the Proveo microscope exclusively. We've actually had a long history with the Leica microscopes. I've trained on them during residency, fellowship, and then also used them while out in practice. So when it came time to upgrade our microscopes in the operating room, we naturally wanted to see what the latest technology and model of the Leica microscope was. In this case, it was the Proveo 8. We got the Proveo 8 in early 2018 and were one of the first places in the country to get it. We were impressed with its increased resolution and also its depth of focus. Also, we liked how it integrated well with the Biome wide-angle viewing system, and that process was seamless. But most importantly, we liked access to new technology with the intraoperative OCT or the InFocus system. So we've been able to use that in a lot of our surgical practice and have been impressed with the results. So InFocus has been a wonderful tool for us. It's the type of tool that the more you use it, the more benefits you get with it. And in particular, we're using it for a lot of our diabetic vitrectomy cases. For some of our patients who have diabetic vitreous hemorrhage, when you see them in the office, a lot of times their vision is quite limited and you're able to not get a detailed view of what their macula looks like. So in these patients, once they're in surgery and we're able to remove the blood, we can get our first glance at the macula, and having the ability to do OCT on these patients gives us information regarding any presence of macular hole, epiretinal membrane, or any other tractional membranes that may be present on the surface of the retina. So we found that to be particularly helpful for our diabetic patients. Also, in cases of diabetic tractional retinal detachments, we're trying to identify planes for dissection. Intraoperative OCT comes in handy. We also use it for cases of submacular hemorrhage where we're replacing subretinal tissue plasminogen activator. So this helps in localization of that. Also, it can be helpful for vitreomacular traction to ensure that there's release of any traction at the end of surgery. And one of the other exciting areas is gene therapy. We're seeing more and more clinical trials with gene therapy medications that are going to be delivered in the subretinal space. So being able to identify those spaces and ensure delivery of medication, I think you'll find that intraoperative OCT will be key for that in the years to come. One of the things that I enjoy about the Proveo is the foot pedal. The foot pedal is completely customizable, and I'm able to control all aspects of the microscope and the OCT, the intraoperative OCT modes I can enter in and out of. I can adjust the focus of the OCT. So having that control all within my hands really is a very comfortable feeling. One of the other things that I enjoy about the Proveo is its visualization. The fusion optics allow greater resolution and depth of focus when you're doing anterior segment work, when we're working with intraocular lenses, but also its integration with the Biome wide-angle viewing system is seamless. That can allow for some improvement in workflow. Simple things like the microscope light turning off when we're starting vitrectomy, auto inversion, these types of modes really improve our workflow. Also, the assistant scope. When you work with residents and fellows, oftentimes you may be sitting in an assistant scope, but one of the unique features with the Proveo is that the view from the assistant scope and the view from the surgeon scope is identical. So that's a really helpful tool. And finally, for recording, I like to do a lot of recording of surgery and video editing, and having an HD camera and an excellent recording system to which I can just connect an external hard drive and I can do my editing on the fly, really is efficient and high quality. The Proveo 8 and the Infocus OCT has helped in improving clinical outcomes, in particular for our diabetic vitrectomy cases. And as we discussed earlier, having the ability to get real-time information on the status of the macula has changed some of our surgical decision making. In short, if it's something you're interested in, I suggest that you try it. That's one of the best things you can do, is do a clinical evaluation, use the Proveo, use the Infocus, and I think you'll get a better sense of the resolution, better sense of the higher level of technology with intraoperative OCT. And the more you use it, I think the more benefits you'll find with it.